Sagittal balancing. Flexion extension gap should be equal. Fixed flexion deformity. Release number 1. Release posterior osteophytes. Number 2. Release posterior capsule with cob. Number 3. Cut more distal femur. Number 4. Release PCL. Number 5. Release gastrocnemius. Coronal instability. Valgus knee. This need lateral release. First, remove osteophyte. Second, lateral capsule. Number 3, tight in extension, iliotibial band, Z-plasty, or release of the Gerdy's tubercle, or multiple transverse stab incisions. Number 4, tight inflection, subperiosteal release of popliteus from lateral femoral condyle. Number 5, tight in both flexion and extension, lateral collateral ligament release. Medial release. First release, osteophyte. Second, deep MCL and capsule. Number 3, PCL release. Number 4, semimembranosus, pie crusting of medial soft tissue sleeve. Number 5, superficial MCL, subperiosteal elevation. If tight inflection, anterior part of MCL release. If tight in extension, posterior part of MCL is released. Full release will lead to instability, can cause EVN of the femoral condyle. Remember McPherson rule. If both flexion and extension gaps are involved, tinker the tibia. If one of the gap is involved, address the femur. If symmetrical gap in flexion and extension, address the tibia. If it is tight, cut more tibia or use thinner insert. Loose, put thicker poly. Asymmetrical gap, address the femur. Tight extension, manage as fixed flexion deformity. Tight in flexion, downsize femur, increase tibial slope. Loose in extension, add distal femur augment, downsize femur and put thicker poly. Loose in flexion, larger femur and posterior augment.